is the median sacral nerve. So when the aorta splits to form the two common iliac vessels, a single branch, looks a little bit like the tailbone, well, actually like the tail, is found on the anterior surface of the sacrum. And that's the median sacral artery, number 47. Now that's out of the way. Alright, so the abdominal aorta ends by dividing to form the left and right common iliacs. And remember what I said, anytime we have a common artery, it's going to divide again to form internal and external. Iliac makes, in all of its branches, pelvic area gets pretty tight, especially in the male cavity because it's smaller, and in the female cavity we add the uterus and vagina, so the larger cavity still has less room. So it can be a difficult area to dissect unless the pelvis is cut in half. The internal iliac artery is going to enter into the pelvis. And then if you were taking an advanced anatomy course, you would learn that it has an anterior and a posterior division and which branches come off of which. All right, there are certain branches that I want you to know, but I'm not going to worry about the correct division and structure that it comes off. So let me just diagram those on the board, and then I'm going to show you an image or two, okay? That will make it a little bit clearer. Not all of these vessels are present on models. The first vessel that we're going to talk about is, and this is the obturator artery. The obturator artery is going to travel with the obturator nerve through the obturator foramen. Anybody remember what type of muscles are innervated by the obturator artery? What location, what compartment? Medial thigh. What does the obturator artery directly lead to? Medial thigh, and those are your adductor muscles. All right, so obturator nerve, artery, and vein are the only structures to pass through that obturator foramen. Largest foramen in the body, everything that passes through is about the diameter of my little finger or less. Okay, the rest of it is just fascia for the attachment of muscles. So obturator artery you'll be able to see in our models in the leg where it's passing through the pelvis into the adductor space. The other vessel that I want you to know is going to be, it's going to pass out the greater sciatic notch back in through the lesser sciatic notch. We saw this when we did the reproductive system. And this is the internal pudendal artery. It was the pudendal nerve, but the internal pudendal artery. All right, because we have an external that we're not going to worry about. And then the internal pudendal artery is going to give off a branch that goes, that goes towards the anal canal, known as the inferior rectal artery. So as the internal pudendal is passing forward towards the labia, towards the scrotal sac, so if we look at it from, here's our pelvis. Remember, we have, we're looking at the female, we have, let me draw that higher for those of you in the back. We have our female, we have our urethra, and down here we have the anus. And the internal pudendal is coming around and then sending superficial perineal branches along to the deep transverse perineal muscles with mobile spongiosis. All right, it's going to send branches here to the anal canal. Those are the inferior rectal arteries. Okay? So this would be internal pudendal. These would be inferior rectal. And then we would have other branches coming off, which are the middle rectal. So we have three rectal vessels: superior coming off of the inferior mesenteric, middle rectal coming directly off of internal pudendal, and inferior rectal coming off of, internal iliac, and inferior rectal coming off directly from internal pudendal. So let me show you those first, and then we'll go back and look at the intestinal organs. The reason I'm emphasizing this here is actually more so you understand the venous drainage when we get to that on Tuesday, because you've probably heard of hemorrhoids. The same cause of inguinal hernias, the extra abdominal pressure can cause hemorrhoids. A woman in labor pushing really hard, increasing abdominal pressure, compressing veins can cause hemorrhoids. And hemorrhoids can be internal hemorrhoids, just inside the anal canal, or external hemorrhoids on the outside where you're wiping and where it can be really painful. Okay? So internal hemorrhoids are caused by middle rectal veins associated with middle rectal arteries, and external hemorrhoids by the inferior. So I have a couple of images to show. So here we're looking at a posterior view because our descending colon is coming on the left side, so you have to be facing that direction for that to work. So it's a posterior view. Here's descending colon with inferior mesenteric. Here's the rectum. Everybody with me so far? Here's the superior rectal artery coming off of inferior mesenteric. Here is our internal iliac, and here is middle rectal. Internal pudendal is going out and below, underneath our UG diaphragm. So this is internal pudendal, and this is inferior rectal. Okay, underneath the levator ani. Here's another image. This is, I think it's taken from Netter's, but it was off of a quiz sheet. So here is our internal iliac. This is the obturator artery. Here is middle rectal. And then internal pudendal running along obturator internus here, that you can see in our reproductive model. Coming down and then giving off here the inferior rectal arteries. And then finally, these last two pictures I just pulled off the internet this morning in the break. So here is external iliac coming along, internal iliac, giving rise to obturator artery. Here is internal pudendal going out and then coming back through the lesser sciatic notch, giving rise to inferior rectal components and middle rectal artery. So in the lab models, first of all, I want you to recognize these as branches of the internal iliac artery. So first of all, recognize obturator artery, uterine artery, middle rectal artery, internal pudendal artery are all branches of internal iliac. In the model, you'll need to identify or x-rays obturator arteries and internal pudendal and inferior rectal. You won't see middle rectal on any model. Right? That would be more of a lecture type question. So we'll look at that on Tuesday. Okay. There are obviously other branches, so we have branches to the vagina that come off, and branches to the seminal vesicles or the prostate gland, but those are branches off of some of the major vessels that we already know. Okay, before we move into the lower limb, I wanted to show you this view of the diagram of the abdominal organ supply. So here you can see the celiac trunk with its branches. So here is splenic going over to the spleen. Here is left gastric. Superior mesenteric is coming down here, going to the right, giving off branches to the small intestine, and giving off branches to the ascending colon and transverse colon. Here is inferior mesenteric, giving off branches to the descending colon and sigmoid colon, and superior rectal artery. So in lab, what we'll do on Tuesday is have lab first again, so that you have an opportunity to study these arteries we've talked about, rather than going and learning the veins before you get a chance to look at the arteries. Because remember, the better you know the arteries, the easier the veins will be. Because we have superior rectal vein right next to superior rectal artery. Superior mesenteric vein right next to superior mesenteric artery for most of its journey, not quite all of it. Here you can see the lumbar arteries. So the organs have been removed, except for the posterior organs. And so here are the lumbar arteries wrapping around the vertebral bodies to get into the spinal column and to get back to the posterior vessels. We'll look at this one when we do veins next week, because that's showing the hemorrhoid structures. All right, so now let's look at blood vessels to the lower extremity. These are not quite, they're almost, let me rephrase that. They're almost as easy as the arteries to the upper extremity, with a couple of additional ones. But you are still familiar with muscles and nerves and bones that have those same names. Okay? So we have the external iliac continuing along the pelvic rim after giving off the internal iliac. We did talk about a vessel that comes off the external iliac when we were talking about the deep inguinal ring and hernias that were medial to this vessel or lateral to that vessel were either direct or indirect. Anybody remember the name of that vessel? Had the word stomach, well, the word for stomach in it. Inferior epigastric. I showed it to you on the model of breastplate yesterday. And then this is going to be external iliac. I don't remember what my number is for external iliac. 52. All right, after it passes over the pelvis or underneath the inguinal ligament, it's now found in the thigh and changes name. Remember how the thigh bones pass from lateral to medial? So the thigh bones are kind of going at an angle like this. The artery is going to go straight down. So we find it primarily on the medial aspect of the femur, all right, not in the adductor compartment, that's the obturator artery, but running along the surface of our adductor muscles until finally it passes through the adductor muscle against the femur to pass into the posterior compartment. So this is our femoral artery. We're being rather basic here. It has multiple branches to supply the muscles of the thigh. And then when it passes through the adductor muscle, it's found behind the knee. What do we call the space of the knee? The popliteal fossa. So this is now the popliteal or popliteal artery. And again, there's enough pressure of expansion in this vessel. If you cross one knee over the other and watch your foot, you can see the foot move as that artery is expanding with each stroke volume. Okay? So it's got enough force to cause your foot to move against the knee. Now, if we take the popliteal artery, and it's going to end by forming two branches. One branch is going to pass through the membrane between the tibia and the fibula, and we're going to find it deep in the anterior compartment of the leg. So behind the deep to the extensor hallucis is longest. On our models, you have to take that off. And this is our anterior tibial artery. It's going to pass the medial malleolus and end up on the top of the foot and enter into an arch at the base of the toes. So where it's on the top of the foot is identified as dorsalis pedis, dorsal foot. And we'll attempt to palpate a pulse there. Someone has a cast on their leg. You want to make sure that it's not so tight that blood's not getting to the foot. So dorsalis pedis is going to be, if this is my foot, dorsalis pedis is going to be along this area, the medial aspect of my foot, just before it turns to form an arch. Okay, posterior tibial artery is going to continue down the posterior compartment of the leg, deep to the gastrocnemius and soleus. So we'll keep drawing it as a posterior muscle. So those are the two branches of the popliteal artery, anterior tibial artery and posterior tibial artery. On the bottom of the foot, right, so posterior tibial goes around the medial malleolus to the medial aspect, just like our nerves and our tendons do. And so it's going to give a branch on the bottom of the foot. And let me draw this a little bit larger here. So here's posterior tibial artery. And in the bottom of the foot is going to send a branch to the, this is the right foot. It's going to send a branch to the big toe. And it's going to send a branch over to the little toe. So if the top surface of the foot is dorsal, the bottom surface of the foot, instead of using the word ventral, we use the word plantar. So this is going to be the medial plantar artery. And this is going to be going to the little toe, the lateral plantar artery. And this would be posterior tibial. So if we were tracing a drop of blood to the bottom of the little toe, you're going to take it down the aorta, common iliac, external iliac, femoral artery, popliteal artery, bottom of the foot. Do we go anterior tibial or posterior tibial? Posterior tibial. Now we want to go to the bottom of the little toe. So we take it to the lateral plantar artery. Okay. Last vessel, and then I want to show you a website where some of these models you can study over the weekend. You can't stay for open lab today. Last branch is a lateral branch of the posterior tibial. What's the lateral bone of the leg? Fibula. So this is identified as the fibular artery. Okay, so again, a lecture type question. This only goes to the ankle. It's not going to go to the bottom of the foot. So it's going to go towards the lateral malleolus. Posterior tibial is going to go towards the medial malleolus. So the fibular artery is a branch of which of the following? The dorsalis pedis artery is a terminal branch of which of the following? So those types of questions, as well as the top of the foot is supplied oxygenated blood by which of the following arteries? All right. Or the medial thigh is supplied oxygenated blood by which of the following? So what artery supplies oxygenated blood to the medial thigh? Obturator artery, exactly right. Okay, so while I was looking for those slides for the internal iliac and its branches, I found this website. Actually, let me pull the screen down, and you can see I'll put it up as an announcement like I did the cardiac cycle one. And there's a lot of website material out there. I would, as a suggestion, I would not look at these models on the website until you've looked at them in class, because they can be rather confusing three-dimensionally. So when students wanted to buy cadaver atlases, I said, buy a diagram on theme or Netters first. And then after you've looked at cadavers, photographic atlases of the cadaver are fine. If you've never seen a cadaver, those photographic atlases are very confusing. And so study the flat diagrams and the drawing diagrams so you understand these relationships, what vessels branch off of where, which are anterior, which are posterior. Study the lab models, but then if you want additional study time, this website happens to have several structures on it that you can use to quiz. So there's heart models. So you can click on a heart model, or you can click, if you're not sure what you're looking at, it'll have the structures labeled. Okay? Now, there's also other sites out there where it's quiz-like. They're more like my practice quizzes, where you have to type it in, and that's engaging your mind a little bit more. If we go back, there is also, it's hard to find some of the wire circulatory models. So they have good images of those on there. So the wire circulatory. So here would be all those branches coming off of the axillary area. You know that's axillary artery right there. This would be brachial. And when I tag it, I'm not going to tag it close to up here where you're wondering, well, where are we quite yet? I can't see the teres major muscle, so I'm not sure. I'll tag it down in this area. You know for sure that's brachial artery. This is lateral, so that's going to be the radial.
Oh.
Radius is the lateral bone.
Oh, I'm on the other side.
And then the ulnar is the opposite side of how I was drawing it on the board.
Right.
All right. But if you're still not sure, you can click on the labeled one. And again, it's not interactive, but it will have those vessels labeled for you. Okay. This part of the wire model gets a little bit hairy.
Whoa.
So this is looking at a posterior view. And you can get totally thrown off. What am I looking at? Right? And don't memorize this picture. Diagram it. You know, understand, look at it in lab first, but when you're coming back to study and review, once you've already studied the model, you can come back to this one. Here's the same view, but from the front. So this looks like a bunch of wires sticking in space. All right, again, I prefer to have the organs, but here we have the spleen. So here would be the splenic artery. Here is the hepatic artery, and gastric artery is kind of shown up here. Here's superior mesenteric artery, and inferior mesenteric artery and vein. But again, these are just wires in space. So I'm not showing you this site right here to study this weekend. But you can use the hearts. There's some other models on here. You should study our wire models first before you come and look at these. In addition, however, to the wire models, there are there's torsos. So in this torso, let me go to the labeled one. This is our brown model back. So here's the celiac trunk, renal arteries. Here's a gonadal artery coming down here. All right, so these are similar to the ones I have on the quizzes. It's just another site, but again, you should know your vessels first. All right, and what sequence is and how to interpret it before you go to a site like this. All right, but I'll put the duck on the screen here. If you want to take a picture of that, you can, but I'll put it up on G2L. Okay, so on Tuesday, we'll do lab first. Let you study the arteries, and then we'll take a quiz, so you can get that taken care of. So probably, Dean, if you're thinking about when to come in, I'm not sure, probably the same as yesterday.
Are you done? Oh, sorry.